came out high inhibition for her, and I did in the beginning use a course of nystatin, and the dose was 500,000 units 3 times a day for 1 month. This is the overview page, so we found blastocystis and the yeast. Right there. So risk factors for Candida include medications. So her risk factor was the oral contraceptive pill. She had stress from her job. She is a researcher at Children's Hospital and works with terminally ill children, so that was her factor for the insomnia. Diabetes is another risk factor, broad spectrum antibiotics, because that wipes out the good bacteria, and then there is overgrowth of the bad and yeast. So the diagnosis, we saw the stool profile culture. There is another test that gives us metabolites of arabinose, and that is indicative of yeast. And we can look at the Candida antibodies. So common symptoms of dysbiosis includes fatigue, brain fog, anxiety, rash and itching, frequent vaginitis in the setting of history of diabetes, steroid use, and frequent antibiotics. So we put her on the anti-Candida food plan. We eliminated sugars because sugar feeds bad bacteria and sugars feed yeast. So we also took her off honey, fruit juices, grains for 4 weeks, and also told her to avoid the fermented food. And the treatments after the nystatin was completed, I switched over to the herbal combination using garlic, berberine, oregano, and olive leaf. For the parasite treatment, these are the known parasite conventional treatments. And then I talked to her about using magnesium citrate to decrease the constipation, because the goal is to have a bowel movement daily, and to continue the warm water intake. And in the 10-month follow-up, she noticed massive improvements. There was no pain before and after using the bathroom, and little bloating after the meals. Her bowel movements improved to the point where she is now having a daily bowel movement. She said, "This is huge. These are really good things. I was in a lot of pain for a year, and the infections were found, and now her goal is to decrease her anxiety and to help her sleep." So for her treatment plan going forward, we stressed the importance of avoiding gluten and dairy for her. So gluten sensitivity, this is an article showing the impact of gluten on the brain, leading to neurological dysfunction. So today we talked about the principles of functional medicine. We talked about specific lab testing to assess the gut function and specific treatment plans. We talked about the 5R program: remove, replace, reinoculate, repair, and rebalance. So the power of functional medicine. We understand what the patients need, listening to their story, what are the factors setting them up for the most recent symptoms that they're having, and we look at the root cause with specific testing. I would encourage all of you to visit ifm.org to see their videos on functional medicine. There is a nice video on the introduction to functional medicine. There's also grand rounds presentations that are available for free online. And if you're a member, you have access to the toolkit and the handouts that I have showed you that are really useful for patients. And I would like to end with a quote that Dr. Bob Rokowski usually uses with his presentations from Og Mandino. And it's so powerful, I would like all of you to repeat it after me. And most of all,
and most of all,
I will love myself.
I love myself.
For when I do,
When I do,
I will zealously inspect
I will zealously inspect
all things which enter my body,
all things which enter my body,
my mind,
my mind,
my soul,
my soul,
and my heart.
and my heart.
Thank you.